Hello, folks. Today we're talking about assessment and diagnosis, and for our presentation, I'm sharing with you. I'm going to review the two assessment tools that we have in our assignment this week, in your reading, and in the other assignment as well. I'm going to talk about those. I've got some questions for you at the end. The two tools that we're talking about is the American Society of Addiction Medicine levels of care assessment. It goes through 7 dimensions of the things that you can assess in a person, and reviews each of them to build a picture of what this person's addiction looks like. It addresses things like intoxication and withdrawal, which isn't in every single person with an addiction that you're going to assess. But if it is present, then that would indicate the need for a certain level of care, right? It would indicate the need for withdrawal management. It's got things in there like recovery environment, which is kind of at the end. I've been in situations where some of these didn't even apply, where the person did not have any recovery environment yet, and that was something that really needed to be worked on, or where they already had someplace set up where they can go. So each of those steps in the 7 dimensions of the American Society of Addiction Medicine assessment is valuable for helping you identify, if you remember from 2 weeks ago where we talked about the different levels of care. It helps you identify which level of care this person that you're working with is going to need to go into. The other tool is our handy dandy diagnostic and statistical manual of mental health disorders, the 5th edition text revision. And that the diagnostic criteria, there are 11 diagnostic criteria in that chapter. Now, if you're working in the addiction field, I would recommend, and you probably would have it figured out, what all 11 of those are. If you don't, then grab a quick reference or your DSM, and you can read right down through what those 11 criteria are. It ends up providing you with a final assessment of whether a person has a mild, moderate, or severe substance use disorder. And what I love about this is all it requires for a mild substance use disorder is 2 or 3 of the criteria to be met. So if somebody has experienced using substances in an unsafe environment and has stopped engaging in social activities, 2 of those 11 diagnostic criteria, then they meet criteria for a mild substance use disorder, and yes, that is a disorder. Okay, now it's not severe where a person is meeting more than, I think it's 6 or 7 of the criteria, but it still gives us a chance to be able to provide services for this person, even if they're not deep into the middle of an addiction. These 11 diagnostic criteria are useful for the clinician, for you as you're working with people, because it provides you with an understanding of the person that you're working with. Do they have a problem or do they not? That's everything in the diagnostic and statistic manual. When you get to your assessment and diagnosis of mental health disorders class, you'll get the chance to see that each of these diagnoses provides you with a clear picture of, is this a problem or is it not? And that's what all the DSM is. It's also useful for the client themselves. What I used to use the 11 diagnostic criteria for, I printed them or copied them onto an 8.5 by 11 sheet of paper. I would take those to one of my addiction 90-minute inpatient addiction groups and hand it out. And we would go through each one individually. We would talk about what that means and what it is, and it gave the clients the chance to self-diagnose, which is really valuable if you have somebody who's kind of ambivalent towards whether they want to be in treatment or not. They get the chance to take a look down through there and say, oh, you know what? I actually guess I do have a problem, and I didn't really think that I was in that bad of shape. It's also helpful. The biggest reason why we may be doing these assessments, both the ASAM and the DSM, are valuable for insurance companies. And insurance companies really give a hard time about keeping people in treatment because they want to save money. And so we want to use the insurance companies to be able to pay for people to be in treatment and get the help that they need. And so you'll need to be able to accurately diagnose and honestly, we don't want to lie, but honestly assess whether the person needs to stay in treatment or not. And hopefully we can justify their continuing treatment. A quick story about that. I've worked with people, especially with private insurances. I did everything that I possibly could, and I got really good at this. I got really good at talking to insurance companies and justifying treatment. But somebody was in our inpatient program with severe substance use disorder and no place to go. That recovery environment was terrible. It was a female in our program, and her significant other was the person who was providing her with her substances and was abusive. And the insurance company still told me that she would be just fine in a partial hospitalization program and returning home. And so sometimes you do everything that you can, and you still don't get what it is that you're looking for to be able to keep somebody in treatment. But most of the time, if you do a good job with this, you'll be able to get the person the appropriate amount of treatment, keep them in care, and get that paid for. So that's where assessment and diagnosis is tremendously beneficial. Okay. 3 things that I want you to think about as you're reflecting on this presentation. I know I went a little bit over. Apologize for that. Comment on the presentation. What was helpful from what I just shared with you? I'm very interested in knowing if anything was helpful, or tell me, no, that was all bogus. I knew that all already, and there's nothing that was beneficial. But if there was something that was helpful, I'm interested in knowing what it was. Are there any other assessment tools that you've seen or that you use to be able to assess for the intensity of a person's substance use? Some things that come to my mind are things like agency intake assessments. If you're working or if you're in an internship, what does your agency use? And does your intake assessment ask about substance use, alcohol, drugs, cigarettes, vaping, how much, how often, those types of questions. And then in what ways do you want to be cautious with assessment? Can you think of any risks or liabilities or hindrances for the person served in assessing them or providing them with their assessment? Maybe is there a problem with that? Think about what there might be that could be a problem with assessment. Are there any problems that you can think of with assessment? Okay, looking forward to seeing what you guys talk about in the comments, and I will see you there.